audience, ladies and gentlemen. In the next few minutes, I would like to show you my 9-month progression. My name is Endre-Botond Gagyi. I'm from Pennsylvania. I graduated as a medical student from the Medical University of Marshall, and now I'm a first-year Ph.D. student at the Center for Translational Medicine at Semmelweis University. My supervisor is Bány Terős, my SMS is Mahmoud Abaidat, and my statistician is Daniel Sándor-Veres. My vision regarding to this topic is that we can reach a state where we can prevent most of the patients from the recurrence and the progression of acute pancreatitis, and my mission is to reduce this recurrence and progression rates. A brief overview with my research projects. The first one is the risk factors of acute pancreatitis progression into recurrent acute pancreatitis and chronic pancreatitis, which will be a systematic review and meta-analysis. Let me briefly introduce its background. The incidence of acute pancreatitis varies globally, affecting from 5 to 80 people per 100,000 and appears to be increasing around the world. Most acute pancreatitis can be completely recovered after standard treatment, but a proportion of patients eventually develop recurrent acute pancreatitis up to 35% or chronic pancreatitis up to 24%. On the right figure, you can see the Sentinel acute pancreatitis event model by VII et al., which states that acute pancreatitis, recurrent acute pancreatitis, and chronic pancreatitis is a disease continuum. Data on the risk of developing recurrent CP and factors affecting disease progression have been heterogeneous, and there is no comprehensive work in the topic. However, in order to reduce this recurrence and progression rates, it is essential to know all the factors that contribute in the progression of acute pancreatitis. Therefore, our aim is to comprehensively assess and objectify all the risk factors that can contribute in the progression of acute pancreatitis. So we would like to focus risk factors at this stage, specifically focusing on risk factors that contribute to acute pancreatitis progression rather than the risk factors for acute pancreatitis itself. As the study examines the risk factors of AP progression, we use the PO framework for presenting the question. Our clinical question is, what is the risk factors of acute pancreatitis progression into recurrent CP? The population includes the patients with the first episode of acute pancreatitis or patients with recurrent acute pancreatitis. The exposure involves the presence of risk factor, the comparison is the absence of risk factor, and the outcomes are either recurrent acute pancreatitis or chronic pancreatitis. We hypothesize that the presence of a risk factor increases the risk odds of developing recurrent acute pancreatitis or chronic pancreatitis in these patients. To achieve our goal, we have done a systematic search in 3 major databases in PubMed, Embed, and Cochrane Library on the 25th of October 2022 using this search key. Here you can see the flowchart for selection. Out of 23,000 articles, we included 71 in the quantitative synthesis after title, abstract, and full text selection. I'm going to show you some results with forest plot presenting different parameters effect on the recurrence rate of acute pancreatitis. On this forest plot, we investigated the effect of the association between male sex and the risk of recurrent acute pancreatitis. The exposure group includes male patients, the comparison group includes female patients, and the event of interest was the development of recurrent acute pancreatitis. And we included 28 retrospective and prospective cohort analysis in this analysis. As we anticipated, considerable between study heterogeneity, a random effect model was used to pool effect sizes, and for the effect size measure, we use odds ratio with 95% confidence interval. The pooled ratio here is 1.45 with low heterogeneity. This result means that male patients have a 45% higher risk of developing recurrent acute pancreatitis compared to female patients. And since the confidence interval does not include 1, this result is statistically significant. Here we investigated the effect of alcoholic etiology on the recurrence rate of acute pancreatitis. 24 retrospective and prospective cohort studies were included in the analysis. Exposure group includes patients with alcoholic etiology, comparison group patients with other etiologies. The event of interest was the same, the development of recurrent acute pancreatitis. The pooled ratio here is 1.76. It is also statistically significant, and this result means patients with alcoholic etiology have a 76% higher risk of developing recurrent acute pancreatitis. The heterogeneity is 81%. Which means a considerable heterogeneity, which can be explained by a lot of things. Even though all articles contains all sorts of etiologies, but the etiological composition of the patients is different, and there are differences in severity, in age, in sex, etc. Here we investigated the effect of smoking on the recurrence rate of acute pancreatitis. Pool's ratio here is 1.45. It is also statistically significant, and this means patients with a smoking history have a 45% higher risk of developing recurrent acute pancreatitis. Here we investigated the effect of hypertriglyceridemia on the recurrence rate of acute pancreatitis. The Pool's ratio here is 2.45. It is also statistically significant, and this result means patients with hypertriglyceridemia have a more than 2 times higher risk of developing recurrent acute pancreatitis. Here we investigated the effect of diabetes mellitus. Pool's ratio is 1.49. It is also statistically significant, and this means patients with diabetes mellitus have a 49% higher risk of developing recurrent acute pancreatitis. Here you can see the identified risk factors. In the first column, you can see the outcomes. On the second, the odds ratio. In the third, confidence intervals. In the first table, you can see the risk factors of recurrence. In the second one, risk factors of chronicity in patients with recurrent acute pancreatitis. And in the third one, risk factors of chronicity in patients with acute pancreatitis. And you can see we separately analyzed the adult population and the pediatric population. The strength of our study is that this is the first meta-analysis investigating the risk factors of acute pancreatitis progression, and its comprehensiveness, it covers a wide range of factors, examining 62 different parameters affect on the progression of acute pancreatitis. The limitation is that the majority of the studies were retrospective cohorts, and the presence of the confounding factors. So we have identified several modifiable risk factors so far. So this is clinically important because by eliminating these risk factors, we may be able to reduce the recurrence and progression rates of acute pancreatitis in these patients. So this is the progress of the first project. We are at the manuscript writing phase. Our second project will be also systematic linear meta-analysis, and it also focuses on the progression of acute pancreatitis. Let me briefly introduce its background. The annual incidence rate of chronic pancreatitis varies between 5 and 12 cases per 100,000 person years. Chronic pancreatitis is a severe condition that greatly deteriorates quality of life and reduces life expectancy, and currently there is no specific curative treatment. A common belief that acute pancreatitis and chronic pancreatitis represents disease continuum, as illustrated by the sentinel acute pancreatitis event model. This model posits that an initial sentinel acute pancreatitis episode sensitizes the pancreas to recurrent acute pancreatitis, which subsequently leads to chronic pancreatitis as a result of ongoing stressors and inflammatory responses. Why the sentinel acute pancreatitis event model is an interesting hypothesis. It implies that all cases of chronic pancreatitis originate from acute pancreatitis. However, a considerable number of chronic pancreatitis patients have no prior history of acute pancreatitis episodes. In light of this discrepancy, our aim is to systematically assess the proportion of acute pancreatitis episodes that occur before the development of chronic pancreatitis. This will provide a more comprehensive understanding of the relationship between acute pancreatitis and chronic pancreatitis, and help refine the existing models of disease progression. So for this study, we have 2 clinical questions. First, we would like to know the proportion of chronic pancreatitis patients with no history of prior acute pancreatitis episodes, but at the same time, we would like to know the specific characteristics of this patient's population. So for the first one, we use the COCOPO framework. For the second one, the PICO. Okay, this is strange a little bit. So the population includes chronic pancreatitis patients, and the outcome is past history of acute pancreatitis. So we have done a preliminary search. We already found 6K articles. The topic is feasible, and a brief overview of the projects. The first one I would like to finish by the end of July, and the second one by the end of September. And thank you for your attention.
I'd like to ask you about your forest plots. Exactly that I saw in some cases that you have articles with the same authors with just 1 or 2 year differences at the publication year. What do you think? Why this could be, and there could be overlapping population, or?
No, I checked these are different authors from different countries, one from China and one from South Korea.
I just want to ask, you mentioned that the majority of the studies is retrospective. Was there any difference between the prospective and retrospective studies when you evaluated your risk factors?
Thank you for your question. This is a good question. So we haven't checked it, but we maybe should.
I have a question regarding the first forest plot that it shows us that in case of male there is a higher chance for developing recurrence acute pancreatitis, and what is your opinion about it? What can be the reason behind it? There is a difference between male and female.
Yes, a very good question. Can be a lot of things. So the one of the major limitations is the presence of the confounding factors. So we know. So here we identified male sex as a risk factor, but we cannot exclude other confounding factors, such as maybe this among the males there are more heavy drinkers, for instance, or more male patients smoking, or so.
Okay, thank you.
That's good.